Hi everybody, I'm Rodrigo, musculoskeletal radiologist, and welcome to my YouTube channel. And in this episode of the meniscal lesion series, I will discuss or I will talk about other critical meniscal functions besides the load transmission. So if you haven't seen that video about the load transmission, take a moment and watch it, okay? Because that video, it's crucial for a better understanding of the meniscal lesions. So that's it. Let's go to the video about the other meniscal functions. So the meniscus is like a Swiss Army knife with many different functions. Besides the primary function of load transmission, the meniscus has a whole package of secondary functions such as shock absorption, stability, joint lubrication, nutrition, and proprioception. So let's dive into each one of them. Let's start with this straightforward and intuitive meniscal function, the stability. Just by seeing the morphology of the convex femoral condyle and the flat tibial plateau, we can sense this function. The intact meniscus limits excess motion in all directions, contributing to the stability of the knee. The meniscus' role in joint stability can be best demonstrated in patients with ACL deficient knees and with lesions or meniscectomy of the posterior horn of the medial meniscus. So let me demonstrate how it works. In normal subjects, the ACL is the primary restrictor to the anterior tibial translation, and the posterior horn of the medial meniscus is the secondary restrictor. So the ACL is the first defense line against anterior tibial translation. When the ACL is insufficient, the posterior horn of the medial meniscus is the backup, reducing the degree of the anterior tibial translation caused by the ACL tear. It is the brake stop function of the posterior horn of the medial meniscus. But when the ACL and the posterior horn of the medial meniscus are insufficient, the tibia is free to translate anteriorly even more. And that is the essence of the meniscal ramp lesion, one of the hot topics in the orthopedic and the radiologic literature right now. And in this case, the surgeon may have to correct the ACL tear and the meniscal ramp lesion to achieve a best possible surgical result. And look at this case when this backup mechanism of the posterior horn of the medial meniscus is off and the brake stop function is not working. The patient has a complete ACL tear and also a meniscal capsular tear along the insertion area of the tibial attachment of the posterior meniscotibial ligament. And this is a type of unstable meniscal lesion, the unstable ramp lesion, and probably the orthopedic surgeon has to address this lesion at the same time that we will address the ACL tear. So if the posterior horn of the medial meniscus were intact, it would stop the anterior tibial translation. In this case, it's not, and we can appreciate that the tibia can move forward without any interference from the meniscal brake stop mechanism or function. There are many interesting things to talk about the ramp lesion, but don't worry, I'll go over the ramp lesion during our meniscal lesion series in the future, okay? So now let's talk about the function or the role of the lateral meniscus on stability. Recent studies have reported that the lateral meniscus plays a significant role in the pivot shift maneuver as lateral meniscectomy increases translation and rotation of the tibia, increasing the pivot shift. Okay, now let's talk about the shock absorption. It has been shown that shock absorption is approximately 20% less in knees without menisci, and its function is associated with meniscal viscoelastic properties. Additional work have identified that it is a multifactorial phenomenon, with the surrounding musculature and the hyaline cartilage playing also a significant role. And now let's talk about the other meniscal function, the joint lubrication, another important function. It's believed that when the knee is loaded, the meniscus compress and circulate the synovial fluid, reducing the frictional forces. It forms a thin layer of synovial fluid between the articular cartilage and the meniscus, distributing the articular pressure and decreasing the friction coefficient. And by the way, in knees with meniscectomy, the coefficient of friction increases by 20%. And before I leave the joint lubrication subject, it's important to remember the composition of the synovial fluid. It's not just water. There are other different molecules that I'm representing here in green, like the proteoglycan 4, hyaluronic acid, and surface active phospholipids that contribute to transforming this fluid into a very effective lubricant. Okay, so now let's talk about nutrition, another meniscal function. The meniscus is also believed to play a role in providing nutrition to the knee joint. A system of canals in the meniscus has been identified by electron microscopy that communicates the synovial cavity and is thought to promote fluid transport and nutrition. And one thing that I couldn't find in the literature is how it's done. If the glucose molecules, they enter in these channels during the compression of the meniscus, or if the glucose molecules enter during the non-compressive phase when the meniscus expands and become more hydrated. And now let's talk about the last but not least meniscal function, the proprioception. And there are many neural elements in the meniscus that indicate that the meniscus can detect proprioceptive information. Researchers have shown the presence of different mechanoreceptors in the meniscus, including quick adapting receptors as Pacinian corpuscles and slow adapting receptors like Ruffini endings and Golgi tendon organs. Free nerve endings responsible for pain sensation are also found. And interestingly, these neural elements are located mostly in the meniscal periphery, accompanying the vascularization pattern. And the neural elements are also more common in the anterior and mainly in the posterior horn of the meniscus, especially near the meniscal root ligaments. And maybe it can explain why meniscal lesions that twist the anterior and the posterior meniscal horns near to the meniscal root ligaments, like buccal handle tears, they can be more painful than other types of tears. So that's it, meniscal functions revised. And here are some references that I recommend for you if you want to go deep into the subject, especially this paper here. Okay, it's a very good one. And in this video, we could revise some other meniscal functions like the stability, like the shock absorption, the lubrication, and the nutrition, and also the innervation, the proprioception, the meniscal proprioception that helps the knee. Okay, so if you liked the video, share with your friends, subscribe to the channel, and press the notification button, right? If you wanna be notified about the upcoming videos and firsthand. Okay, so thank you for your attention. Take care, and until next time.